Fazeela Abbasi. Thank you very much. And also,
put your
Fazeela, thank you. Over to you, please, Fazeela.
Yes. Good morning, everyone. It's a pleasure and a privilege to be here as a guest speaker today and share my clinical experience of using the Erbium Yag Laser, both in the ablative as well as in the fractional mode, treating the acne scars as well as the post-inflammatory hyperpigmentation in skin types 4 and 5. Now, before going off with my very short and tight presentation, I would like to give you an overview of my educational background. I'm a graduate of St. John's Institute of Dermatology, London. I have a private clinical practice of my own, and I'm also an advisor in the Ministry of Health in my country. Doctors, we know and we understand that treating the acne scars as well as the post-inflammatory, and that's because of one major fear of having post-inflammatory hyperpigmentation after using the laser. The different treatment modalities that have been in use to treat these problems, they include the chemical peels that I'm sure we'll be talking about that in a bit, surgical excision, dermabrasion, tissue augmentation, and of course the lasers. Now, the Erbium Yag laser, I assume most of the doctors sitting here, they use lasers, so I'm not going to go into the details of the chromophores because we understand that's the water. And that's just one important thing, that this is 10 to 15 times better absorbed by water in the skin than the CO2 laser. So the collateral damage is going to be less. This is what my personal experience says. And the results are going to be better. Now, in my clinical trial, before starting off with the laser procedures, 4 things they were ensured. One was the acne was under control by using the topicals as well as the oral medicines and the light-emitting diode therapy. And if any of the patients was on oral retinoids, it was made sure that the patient was off the oral retinoid treatment 1 month before hitting with the treatment. And on the day of procedure, patients, they were prophylaxed with antibiotics as well as with antivirals if necessary. Pre-operative and post-operative instructions, they were strictly followed. Now, 7 patients, they were enrolled in this study, moderate to severe atrophic facial acne scars, skin types 4 and 5. They were given just the topical, not just the topical anesthesia, but the intradermal injections of xylocaine and nerve blocks in very few of the patients. The parameters used, that was 800 millijoules. The mode was short pulse, spot size 3 mm, and the number of passes. Now this is important because this was the criteria of how deep I was going in the skin. And that was, I kept on ablating the skin till the pinpoint bleeding point occurred. So that means I was in the reticular dermis, and that's when I had to stop. That was my stopping point. After resurfacing, subcision with a no-car needle. Now, I don't know how many of you they are involved in the surgical procedures, but that this was a needle, and this is a needle that's being used in the hair transplantation procedures. So this needle was used to, this is a needle as you can see, it's 18 gauge needle, and this was used to subsize the fibrotic scars. So what I did was, after resurfacing, I inserted the needle in the skin and I tried to cut the fibrotic tissue, releasing the tension and trying to basically bring the depressed scar tissue to the level of the surrounding skin. The first evaluation was done basically after 1 month, and the only side effect that was seen was the post-inflammatory, the post-treatment erythema or the redness. But that redness or erythema that resolved 2 to 3 months after the procedure, no blistering or hypertrophic scarring or post-inflammatory hypopigmentation, none of those things they were seen. It's just the redness and then the post-inflammatory hyperpigmentation that was seen in just 2 of my patients, and I used topical bleaching agents and the Q-switch ND Yag laser to deal with that. This is after 1 month. You can see that this has beautifully healed, and a little bit of the redness or the erythema is seen after 1 month. But then no blistering, no hypertrophic scarring, no post-inflammatory hyperpigmentation. In this patient, we had post-inflammatory hyperpigmentation, and I gave her a few of the Q-switch and Yag lasers. So basically, excellent clinical improvement.
Thank you very much indeed.
Just a few of the other slides left, and then also the fractional Erbium Yag mode, because the same laser but in a fractional mode. And again, 10 of the patients, they were enrolled in the study. The parameters used, that was 3 joules. It was in a smooth mode, as we know, this is a fractional mode of the Erbium Yag laser. And then there was just one criteria, and that was a stacking mode. So again, trying to go into the papillary or into the reticular dermis in a stacking manner, keeping the laser on one place and just give pulses in a stacking mode. The results after first evaluation, that was done 3 months after the procedure, no side effects, no post-inflammatory hypo or hyperpigmentation, and you can see that this is after 3 months. Before and after.
These are wonderful results. Fazeela,
yes.
I'm going to ask you to draw it to a close because we must keep to time.
Yes, we are done. Before and after. And we're done with it. We're done with the presentation. Thank you.
May we ask you, which do you think is the most important aspect? Do you think it's the laser or the subcision?
I think laser.
Can the next speaker come up to the podium, who is going to be J. Sherry Sharad, so that there's no time lost?
Yeah, Chris, both of the things are very important, and that's why we have to do subcision after the laser procedure.
Yeah.
That's also important.
Marina, come and speak at the...
There was a very nice presentation, very nice results. I don't think this is on.